Why are second-line anti-TB drugs important for XDR-TB? Imagine facing a battle where most of your usual weapons no longer work. That's what it's like treating extensively drug-resistant tuberculosis, or XDR-TB. This form of TB is resistant to the main first-line drugs like isoniazid and rifampin, which are usually very effective. But it doesn't stop there. XDR-TB also resists key second-line drugs such as fluoroquinolones and injectable medications like amikacin, capreomycin, or kanamycin. This makes treatment incredibly challenging because the bacteria have become resistant to most of the standard options. Because of this resistance, doctors have to turn to other second-line drugs that might still work. These include newer medications like later-generation fluoroquinolones, Linezolid, Bedaquiline, and other oral agents that are not part of the usual first-line treatment. These drugs are vital because they are often the only options left to fight the bacteria effectively. Without them, the bacteria could continue to grow and cause severe illness or even death. The reason second-line drugs are so important is because XDR-TB bacteria are resistant to the most potent drugs we have. This means that treatment success depends heavily on these less common medications. Studies show that patients with XDR-TB have lower chances of recovery compared to those with drug-sensitive TB. However, including drugs like Bedaquiline and Linezolid has improved outcomes and helped reduce death rates. It's also important to note that second-line drugs tend to have more side effects. They can cause issues like hepatitis, depression, hallucinations, or hearing loss. Because of this, treatment often lasts longer and needs careful monitoring by healthcare professionals. Managing these drugs requires specialized care and access to laboratories that can quickly identify which drugs the bacteria are still sensitive to. This helps doctors choose the most effective combination and avoid further resistance. Using the right second-line drugs based on precise testing is crucial to prevent the bacteria from developing even more resistance. If resistance continues to grow, it could make TB treatment nearly impossible. That's why these drugs are a lifeline for patients with XDR-TB. They provide the best chance of controlling the disease, improving survival, and preventing the spread of resistant strains. In summary, second-line anti-TB drugs are essential because they are often the only effective weapons against bacteria that have become resistant to first-line and some second-line medications. Their careful use, guided by accurate testing and expert care, is key to improving treatment success and saving lives. But it's also important to remember that these drugs come with challenges, including side effects and the need for longer, more complex treatment plans. Always consult healthcare professionals for personalized advice and treatment options.